it's a different experience.
It's intense.
It is intense, and I was afraid, like swallowing, that I might mess something up by swallowing.
The swallowing is okay.
The swallowing's okay?
Yeah.
Because that's what I kept thinking. Don't
the key
swallow,
thing is that the 20 seconds or so that the laser was on, you were fine. You looked right at the light, you concentrated. The thing is tracking your eye anyway, so little movements of the eye are compensated for by the tracker of the laser.
Okay. You
just can't look all around the room, and you didn't, so we did fine.
Okay, good.
Now we're going to just check the flap alignment, and then I'll go over the drops with you, and we're all through. Yeah, looking good. So everything's lined up the way it should be. Blink. So you're all set. Now, right now, it feels really good because it's numb.
Okay.
And as the numbing drop wears off, you will have a slight foreign body sensation. You're actually feeling the edge of where the flap is. So it'll feel a little bit like there's a lash in there.
Okay.
And then usually in a couple hours that goes away, and you're going to just be putting drops in to lubricate it. And then you're going to have protection.
For the first couple hours I'm putting drops in.
You put drops in almost every hour
to
keep it lubricated and to help decrease the swelling. And then you'll wear a shield to guard it, and you just don't want to rub it for the next few days to make sure you don't push the flap. So here we are with Sandy, first day after her LASIK procedure, and her right eye targeted for monovision. So we're just going to ask her how she did as far as pain and how she's doing as far as the vision so far.
I thought it was very easy. I was uncomfortable for maybe 3 hours, tops 4 hours, but not even very uncomfortable. I didn't even take Advil.
Okay.
And it's been great since then. I haven't had any pain since then.
And we just checked her vision, and she's got about 20/40 to 50 for distance, which is where it should be for a mono eye. And she's already reading pretty well, and she'll get a little bit better as it heals. And then we're going to do her other eye on Friday. Then you'll have 2 eyes. That'll be good.
That will be good.
Thank you.
Thank you.
Okay, here we go again now. We did the flap now in your left eye. That's going to be your distance eye. And we did the right eye, I think a couple days ago, as the reading eye. So how are you doing on the reading?
Pretty good.
Do you want to show everybody what you can read now?
Yeah.
So she's covering her left eye, so she's only reading out of the right eye. I'm going to give her a little more light.
And
so how far down can you read on that card?
Second from the bottom.
And what is that?
It's 937626.
Yeah, that's great. So now we're all set to go in there and finish the left eye, and then tomorrow we'll get the follow-up vision on that eye. Thank you very much.
Sounds good.
All right, here we are with Sandy again. Now we've done her second eye, which was the distance eye yesterday, and is my practice. I always do one eye at a time. First for safety, and second to help us predict the outcome in the second eye. So it's a little inconvenient, but overall, Sandy, what do you think about the idea of doing one eye at a time?
You know, I was concerned about doing the surgery to begin with, so knowing that I could do one eye, and if there was a problem, I still had my other eye, actually was one of the reasons that I ended up coming to this office, is because I really wanted to do one eye at a time. Even though it is a little longer process, I think at the end of the day, I think it's a much better idea.
Well, great. Yeah, the other thing we learned, because I knew what the effect was in your reading eye, I actually put in slightly more treatment than we would have normally done for your left eye based on the response in your first eye. So now we just checked your vision, and you read 20/20 in your new eye. That's the distance eye. And you were reading the card for me a minute ago up close with your reading eye. So how do you like the idea of mono? Because I kind of talked you into monovision.
Yes, because that's also another thing is I wanted only distance vision. I really wasn't interested in monovision. But because of my age, you had suggested that I really should go with monovision, and now I'm so thrilled that I did. I'm really, really, really happy with the outcome.
Yeah, and your age is not that you're getting older. You're just more mature now. That's all it is.
That's right.
Well, great. Thanks for the interview, and you're going to look for yourself on YouTube pretty soon.
Well, thanks for the eyes.